going to just carry on now and talk a little bit about managing concussions. And I appreciate that many people here are not physicians, and so the question comes up, what do we do if we're a trainer? If we're, how do we manage this? What do we do? And so the first thing, believe it or not, is to recognize that a concussion has occurred. Now, in some cases, it may be obvious. The athlete may clearly get hit, they may, if they have a loss of consciousness, if they're down on the ice of the field, that's pretty obvious. They may even come back to the bench complaining about a headache or being dizzy. So they may give you the information that makes you suspect a concussion, but not always. And I'll read these out for the benefit of translation. This says how to recognize the moods of an Irish setter, and the point is they all look the same. Well, it's not obvious what mood that Irish setter is right now. It's not always obvious that a concussion's occurred, and they're not always the same. And so that's why it makes it a little bit more tricky. Sometimes it can be very subtle. Anybody recognize anything wrong with this picture? Massive door prize for the first person who gets it. Spelling's wrong. I lied about the door prize. Sorry, I just had to come up with something quickly. Yeah, arguably the greatest player who's ever played the game. Name is spelled wrong. So there's a question that maybe the Rangers equipment guy may have had a concussion from the night before. But that's actually one of the quickest responses we've had. I've shown this across the country, and often it takes a while to look at it. It's obvious, but sometimes it's right in front of your face and you still don't get it. Not all concussions are obvious, so you need to be careful. So if you see your player take a big hit, you want to make sure you maybe ask some questions, because they may not tell you, especially when they don't want to come out of the game. You may try to hide things, or they may just not understand anything bad has happened. So watch for certain behaviors. Watch their performance. So if your star player is suddenly their performance has really reduced, then that's something to watch. I'm afraid it doesn't work the other way. There's a great story that a player who was playing for Edmonton got hit really hard, and the coach asked the trainer, how he was doing, and the trainer says, well, he doesn't even know who he is. The coach said, well, tell him he's Wayne Gretzky and get him back on the ice. But unfortunately, it doesn't work that way. But certainly, if you see an impairment in play, watch out for that. Behavioral changes. You may see an abnormal behavior for that player. Player's normally enthusiastic is now quiet, crying. One of the interesting things that a coach told me, and it's really true, is watch the player who doesn't want to go out and eat with the team after the game, especially if you're with a team that's traveling. If they say, no, I'm fine, I'm just going to go back to the hotel room, or I'm going to go home. Watch for little subtle clues like this. You have to make sure you ask the right questions, because it's not always going to be presented right to you. This says, here's the problem. The keyboard and hard drive are fine. The trouble seems to be that your monitor is a microwave. Again, you have to ask the right questions. You have to be observant to make sure you get to understand whether or not a concussion's occurred. In addition, when you're at a game or you're covering, this is an interesting picture because it's the only known picture of the Montreal Concords, I think, that actually is in existence. But when this happens, clearly he can sustain a head injury. But if you're involved with games, the other problem, of course, is in that type of scenario, a neck injury could also occur, and you can't miss that. So you'll notice that, certainly in pro sports, if you see somebody get knocked out or have an altered level of consciousness on a big hit, often they're taken off the ice or field on a backboard under spinal precautions. Because, of course, if they can't answer questions properly, they can't answer questions that we would ask to assess, can you feel your fingers and toes? The things that we would ask to evaluate whether or not a spinal injury had occurred. So you have to be careful with hits to the head. Concussion isn't the only thing that can occur. And those of us who work with teams will spend a lot of time making sure that we've rehearsed that. So you'll see that. It's interesting, in the CFL, when we took guys off, I had the unusual experience of having to take a guy off in Edmonton. And in hockey, they'd be holding everybody back to prevent a fight. In the CFL, everybody got around and did a prayer circle around the athlete. So it was a different experience, but which caused him to kind of freak out. And we were trying to tell him he was okay. But being prepared is important if you are covering games. The other thing is, not only do other injuries occur at the same time as concussion, but watch out for concussion with other injuries. So if these two football players collide, there's a good likelihood that there may be a shoulder injury there. But any injuries to the shoulder, neck, jaw, nose, you also have to be careful that there may not be a concussion. So these are where you have to ask the extra questions to see if that's happened. What do you do if you suspect a concussion? you take them out of the game or practice. So if you have a reason to suspect, the first thing you do is you take them out. Why do you do that? This says, well, I guess I'll have the ham and eggs. This is a very bad decision in this particular environment. It's a very bad decision to leave somebody in. Why? Because once they've been concussed, their risk of more severe injury, if they stay in the game, is much higher. Risk of their symptoms becoming worse, risk of their symptoms being more prolonged. Many of the athletes I see who have prolonged concussion problems are ones who go back in the game after they've been concussed. The risk of other injury, take a downhill skier who's concussed, you lose that little bit of coordination and timing. That could be a huge risk in terms of other injury. There's also something called second impact syndrome, which you may have heard of, and that's basically a condition where you get brain swelling after you've been hit once and you get a second hit, even more minor, can cause brain swelling, and it ultimately leads to death in most cases. Now, this is not common, this is quite rare. It tends to occur in children and adolescents, not in adults per se. But, of course, death is not a good outcome, so if there's even a tiny risk of this, you want to deal with that. But the key thing is, if you put them back in, the risk of more severe symptoms, the risk of longer symptoms is much higher. So they've got to come out of the game or practice. And it involves a lot of education because nobody wants to come out. So they need to understand why that is. Assessment on the sideline, I mean, you may have a doctor there, you may have a therapist. The big thing, of course, is if you feel that there's been a concussion, you want to make sure if you're not somebody who can assess them properly, that you get them to somebody who can. This says, what is an isosceles triangle and what year did Teddy Roosevelt write up San Juan Hill? Who invented dental floss? And the other guy says, it's probably a concussion. He's been unable to answer even one question correctly. So the first thing you do is you ask them questions. And we tend to say, well, what day is it? What's the date today? I'm not really sure that I know what today's date is exactly. I know it's Saturday. Asking athletes these questions is not that helpful. Ask them questions like, who are we playing? Where are we playing? What's the score? That's the type of thing that they're going to be connected to. And if they don't know, and you're asking that as a coach or a therapist or a parent, then obviously they've had a change in their thinking, and you are concerned about a concussion and they need evaluation. Dr. Leclerc has already brought up the SCAT-2 form. For those of you who might be therapists, you may find using this very helpful at a game as well to direct you to some appropriate questions. Also, the issue of computerized testing that Suzanne also mentioned. This is very helpful if you have a baseline test on your players. Unfortunately, some of these companies are billing this as the way to manage concussion, like a standalone. This is not a standalone. This is just another tool that we can use, and it's useful if we have a baseline. So if I know what your testing was like before you were concussed, then I can test you again afterwards, and it gives us a guideline to know when you've returned to normal cognitively, but it's not a standalone sort of thing. When we do a medical examination, Suzanne's gone through that already. If you are the seventh defenseman on a professional hockey team, not only do you not get to play, but you also have to pose for the doctor's concussion picture. So this is the downside of not getting in the lineup. We will do assessments. The physical assessment is not that detailed for concussion. We don't pick up that much, but as Suzanne pointed out, and she has more sophisticated video, I just have stills, balance testing is very important. But a key thing again, many people, if you try those tests yourself, even non-concussed, many people have poor balance. So it's important to, in that respect, I think, to have a baseline on your athletes in terms of how they do on balance testing as well, because not everybody has good balance to begin with. You would probably think I was concussed if I did those tests. Imaging, again, has been touched on. Many people come in and say, well, why didn't I get, my kid went to emergency and they didn't get a CAT scan, they didn't get an MRI. There are now some great research studies that have helped to determine when imaging is necessary in head injuries. We don't want to over-image, especially kids, and so imaging is useful if there's a concern about a structural injury, but if the evaluation shows no concern about a structural head injury, then imaging is not going to be useful because it's just not going to show anything, as we've discussed before. So that's kind of an on-the-ground look at managing concussion. Now we've got our concussed athlete, we've identified, we've evaluated. Now we have to manage it appropriately and hopefully return them to play. And I'll turn the podium back over to Dr. Leclerc.